Welcome back, students. It's Mrs. Ohms, Shelley. We're going to talk today. This is Unit 11. The first slideshow I'm going to do is the respiratory system, which is Chapter 20 in your book. That's just a picture of your respiratory anatomy. So respiratory has to do with your breathing. First picture up there is your pharynx. Your pharynx is also, in lay terms, is your throat. Then it shows your larynx, which is your voice box. And then your trachea is just below that, and that's referred to as the windpipe. And then you have the bronchus, and then the bronchioles. So the trachea goes down, and then it splits from the trachea into the bronchus. And then the bronchus tree branches out to the bronchioles. And then you have the lungs. And it doesn't say that on here, but you have 5 lobes in your lungs. And there's only 2 on the left to make room for the heart, and 3 on the right. Functions of the respiratory system. It filters the air that we breathe in. It brings oxygen into the lungs. It removes carbon dioxide from the lungs. And it produces sounds associated with speech. A respiration is considered breathing in and breathing out. So an inspiration is an inhale or breathing in, and an expiration is breathing out or an exhale. So 1 respiration would equal 1 inhale, exhale. So every time you count a respiration, it would be a in and out, it counts as 1, okay? Changes in the respiratory system due to aging. Their lung strength decreases. The alveoli become less elastic and decrease in the number. So on the picture, it didn't really show alveoli, but beyond the bronchioles, or at the end of the bronchioles, is where the alveoli is. And it's less elastic and decrease in number. Airways become more stiff. Lung capacity decreases. Rib cage changes. Some of them start to slump over a little bit, and that kind of crowds their lungs. And their chest muscles weaken, so it's hard to get a good cough sometimes. Cough reflex becomes less effective. Cough weakens. Oxygen and blood decreases, and their voice weakens. You can always kind of tell somebody's age, sometimes just by listening to how they talk. They'll have a weaker voice when they're older. Disorders of the respiratory system. The first one we'll talk about is chronic obstructive pulmonary disease, referred to as COPD. But when somebody has COPD, that means they have chronic bronchitis, which would be inflammation of the bronchioles, and then emphysema, which would be like mucus filled in the alveoli at the end of the bronchioles. Another disorder of the respiratory system that you hear a lot of is a pneumonia. It is inflammation of the lungs. It can be caused by a virus or a bacteria or chemical irritants. Right now, of course, we know we have the coronavirus going on right now, which is causing terrible problems in the lungs. Elderly are at higher risk of developing because of the changes that they have as they age. Asthma is a common respiratory disorder. Asthma, irritants, allergens cause inflammation in the air passages. Asthma can be induced by stress and exercise. It can also be triggered by strong smells and smoking. That's why we tell you guys not to wear strong perfumes, colognes, when you're job shadowing, because that could trigger somebody who has asthma. Mucus is produced, which further constricts the bronchi, and then air gets trapped in the lung, and that's why somebody who is having an acute asthma attack, you will hear wheezing. Tuberculosis, that's a little test we did on our arm. It's a highly contagious airborne disease caused by Mycobacterium tuberculosis. It's a pulmonary disease. It can be You can get it in other places than your lungs, but most commonly it's a pulmonary disease, which means it's in the lungs. That's what pulmonary means. Causes prolonged coughing, coughing up blood. The medical term for coughing up blood is called hemoptysis, shortness of breath, night sweats, weight loss, and fatigue. If left untreated, it may cause death. Sputum collection. You had the specimen collection handout for last unit, but this one is just kind of focusing on sputum, which is the junk we cough up from our lungs, okay? So mucus is coughed up from the lungs or the bronchial tubes. It's not just from the mouth. It has to be a deep cough. They cultured for evidence of infection or to diagnose lung disease or TB. The best time to collect a sputum specimen is in the morning when they first wake up before they eat. The resident should rinse out their mouth with water before they collect it, and then do not rinse, but not with mouthwash, just with water. Have resident take 3 deep breaths and then cough from the lungs. Expectorate sputum into a sputum collection container, which is usually a sterile cup. It's usually the same kind of cup that they use, like for urine, sterile urine samples. Oxygen, it's on page 360, 365 of your book. It is considered a drug, and therefore it must be ordered by a doctor. Guidelines for nurse assistants caring for residents with oxygen. You will never be the one to start or stop oxygen. You will not adjust the flow rate. Any problems with delivery device or resident should be reported to the nurse immediately. Nasal cannula. In the first picture there, nasal, obviously the cannula is going in her nose holes. Has a set of prongs that go into each nostril, and it's most comfortable for use. Now, nasal cannula is for somebody low dose oxygen, maybe 1 to 6 liters. Okay. The simple face mask is the other. It fits over the mouth and nose. It's a higher concentration of oxygen. It's not as comfortable for the patient, and it also interferes with eating and talking. Most likely at a nursing home setting, you're going to see them on a nasal cannula. And, if things go bad, then they'll get the mask. Some of them have to have a mask, but most of them are on low liters of oxygen. This is an oxygen concentrator. You'll see that a lot at the nursing home. This filters oxygen from normal air. It delivers a low flow oxygen, usually per nasal cannula. There's a humidity bottle attached, and the humidity bottle and tubing are changed weekly in PRN. So at the nursing home, you'll see these, and they stay in the room, and then when they take them out to the dining hall, they get switched over to a bag that has a smaller oxygen tank, so they're more mobile and don't have to bring the big machine with them, like to dinner and stuff. So when that happens, you would ask for assistance to switch them over. You always want to make sure that you're not switching them over to an empty oxygen tank, and that you make sure it's turned on and those kind of things. So, incentive spirometry or spirometer. I don't know if anybody's ever had surgery. You've probably got one of these. It's used to expand lungs after surgery, illness, or injury. It encourages the patient to cough and deep breath, and deep breathe, and helps to prevent pneumonia and atelectasis. So after surgery, it just kind of gets your lungs opened up so nothing settles in there and you don't get pneumonia. Atelectasis would be a collapsed lung. It's the medical term for that. This video I sent to you on your communication page. There's a link to that on your Unit 11 homework. And that's all I have.